Joining us now is Jerold Mande, CEO of Nourish Science and adjunct nutrition professor at Harvard. Really glad to have you here. All right, America spends almost twice as much on healthcare per capita than other wealthy countries, but we have the lowest life expectancy of any of them. Why?
Well, Elizabeth, thank you for having me. You know, that's a great question. And it's because of how little we do to prevent illness. And it's because our food is making us sick, frankly. And of course, food's basic purpose is for us to thrive. And yet we've ended up with a food industry producing products that, if eaten as intended, will make you sick. And it's not only that Americans have the shortest lifespans amongst all the wealthiest 20 countries, our kids are sick. We heard that today. 20% have obesity, 20% have prediabetes, fatty liver disease, unthinkable in kids. In fact, they even had to change the name. You know, it used to be adult onset diabetes. They had to change it to a type 2 because of kids being sick.
Highly processed foods make up 73% of the American food supply. RFK Jr. promised this would be his #1 priority. He didn't say how he would make our food safer. So what do you think he should do? How do we do that?
Well, there are two things we need to do. I think first, overall, we should set a goal as a nation to ensure our children reach age 18 at a healthy weight and in good metabolic health. Today, the goals of all of our food and nutrition programs is just ensuring access to healthy options, information like labeling. But we really should set as a goal to get our kids to 18. You know, I talk about this. I worked when I also at FDA. We regulated tobacco. 25% of young people smoked, less than 2 today. So we can take on these tough problems. Specifically, how do we do this? One, the FDA needs to regulate the design of ultra-processed food. They need to tell companies, yes, taste, cost, and convenience should be 3 of your sort of 4 North Stars, but the 4th is health. You have to do the research and prove to us that the food you're designing can be eaten as you're intending and not make people sick.
You know, these ultra-processed foods are designed by actual food engineers to be irresistible, so that we'll eat more and more and more. I mean, this is a major effort that goes, that these food makers are making that would have to be now undone.
Well, you know, back in 1990, obesity there wasn't a single state in America that had a 15% obesity rate, and the child rate was much lower than that. 30 years later, almost half the country is obese and 20%. What happened over those 30 years? And what's happened is we went from eating food, mostly grown with minimal processing, to food that are really industrial formulations by company. It's not inherent that man-made food should be bad for you. And I think someday, not now, but 100, 1,000 years from now, if we do the science, we'll need to be able to make man-made food that we thrive on. But today, man-made food is synonymous with food that makes us sick because they're being designed just to make companies more money. They're not really being designed so that we will thrive.
But we even hear, I mean, you know, the flour that we use, that we buy in a store, that goes into everything, much less the corn oils. It's not just the food manufacturing plants that are making this food unhealthy. It goes back as far as the farms and what we are giving our cows and our sheep and our pigs in terms of hormones. I mean, Europe has a ton of this stuff banned. Why don't we in the U.S. have this banned?
Well, food companies are powerful, and we have a political system that enables them to translate that power into votes. You know, it's blocked the investment in nutrition science. We have very low investment in nutrition science. You know, we have National Institutes of Health. We have institutes for heart disease, cancer, diabetes. We should have those. They should be working on treatments for those diseases. But, you know, they all have in common that they're caused by our food, yet we have no Institute of Nutrition to figure out why. And so we can give the FDA, we can give the companies guidance on how they can design foods and regulate them to keep them so that we thrive on them, and certainly that they don't make us sick.
Well, listen, it's not that you have to give up your French fries, but the potatoes need to be grown without the fertilizers that can linger on those potatoes. They need to be made in oil that isn't so terrible for you. In other words, I mean, you know, I was an Army brat, so I spent a lot of time growing up in Europe. You don't have to give up some of these great foods. You eat them when you're overseas. but they're just made in a much more healthy way.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.